How's it going, guys? Pass level question for, actually, it's not pass level, I'd say medium difficulty question for Gastro Path Step 1 and Pediatrics 2CK. So, 1 week old neonate, male, and he's got this barium enema shown, which is going to be Hirschsprung. Okay, so spot diagnosis here where you can see that you have constriction distally in the colon where neural crest cells have failed to migrate distally, which results in inability to relax the distal rectum, okay, slash sigmoid colon. Varying severities, but when you see this image, the bird's beak appearance in barium enema, that's Hirschsprung, okay, and obviously if we had it up top in the esophagus, bird's beak, that'd be achalasia, unrelated. So questions just asking patients who, neonates who are born with Hirschsprung, which of the following could be seen, okay, so let's look at the answer choice here. Choice A, hematochezia, wrong fucking answer, okay, well, this is bright red blood per rectum. This is classically when we have a lower GI bleed, which means distal to the ligament of Treitz, which is what separates the duodenum from the jejunum. Okay, so if we have a bleed proximal to the ligament of Treitz, duodenum upwards, there's more of an acid effect on the blood in the small bowel lumen, which causes melena, okay? Unless you have a massive upper GI bleed, it's a long discussion, but classically, melena, upper GI bleed, hematochezia, lower GI bleed, wrong fucking answer. Choice B, hyperthyroidism, wrong fucking answer. So this is not classically associated with Hirschsprung, okay? So I'll talk about this a bit more as we move through the question, but hyperthyroidism for the moment, some of you probably confused. You say, how does this relate? You're right, it's fucking wrong. Choice C, leash nodules, wrong fucking answer. These are iris hamartomas that we see in NF1, neurofibromatosis type 1. Okay, so unrelated, threw this in here as a distractor. So leash nodules for NF1, also pheochromocytoma, neurofibromas, which are nodules under the skin, axillary groin freckling can have cafe au lait spots, okay, hyperpigmented macules, can have weird brain tumors, oligodendroglioma, ependymoma, optic glioma, okay, tumor of cranial nerve 2. Leash nodules, wrong fucking answer. Choice D, lymphocytosis, correct answer. So you need to know that Hirschsprung is associated with Down syndrome, and then in Down syndrome, you can get ALL in kids. Some students get hyperpedantic and say, OMG, can it be AML type M7? It's fucking wrong. Okay, it's ALL in kids. Now, this isn't me trying to be fancy or creative. There literally is an offline NBME question for step 1 where they just give you a very buzzy, like 1-2 liner on Down syndrome. They're like, kid is born to a woman 48 years old, and he's got single palmar crease, slanted palpebral fissures. You're like, okay, it's Down syndrome. Say which of the following is most likely to be seen as patient, and the answer on that question is excess lymphoblasts. Okay, so it's not hard when we talk about it. You're like, oh, right, that's right. You know, we can see ALL. It's not hard, but when students approach that question without that on the forefront of their mind, I see them get it wrong quite frequently. Okay, so you need to know that ALL common in Down syndrome, Hirschsprung, duodenal atresia. Okay, so if we gave you an AXR, abdominal X-ray showing a double bubble sign, highly buzzy. Now, you don't get leash nodules, you get what are called brush field spots, OMG. Okay, I talked about this in my high-yield ophthalmology PDF that I just put out. I also mentioned them, interestingly, in the high-yield genetics PDF too. So brush field spots are just lesions on the iris you can get with Down syndrome. You don't get hyperthyroidism. There is an increased proclivity for congenital hypothyroidism, Down syndrome. It's not exceedingly high yield, but I mentioned before I would discuss quickly how thyroid could relate to Downs. Well, hyperthyroidism, no, but hypothyroidism you can get. You can also get eustachian tube atresia. Okay, those are two like weird mini factoids about Down syndrome. You can get congenital hypothyroidism and eustachian tube atresia, but you should know for GI that you can get Hirschsprung, you can get duodenal atresia with double bubble sign, and then for hematology, you can get ALL, okay, so acute lymphoblastic leukemia, where you're going to have a leukocyte count greater than 30,000 in, I'd say, 4 out of 5 questions at least, and it's going to be all lymphocytes, okay, CD10, TDT positive. Finally, telescoping of bowel segments, wrong fucking answer, refers to intussusception. Okay, so classically occurs in the ileum. So even if you wanted to just state the possibility, entertain the notion of, well, if we have an anatomic abnormality within the large bowel, i.e. Hirschsprung, couldn't that increase the propensity for something like intussusception? It's not a bad thought, but it's fucking wrong. Okay, so intussusception, it's almost always going to be within the small bowel, ileum more specifically, and that's going to be a kid who has classic intermittent crying, squatting, vomiting. There can be blood in the stool, and there is a mass oftentimes with intussusception. Okay, so you get a sausage-like mass sometimes, whereas congenital midgut volvulus, there's no mass. That stuff's more pediatrics 2CK. Telescoping of bowel segments, wrong fucking answer. You know the deal. I'm going to make more content. If you like my stuff, subscribe my channel. Appreciate your time. That's it.